Greetings to the leadership and members of the National Minority Quality Forum and other luminaries, including members of the Congressional Black Caucus. My name is Tony Fauci, and I am the director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health and a member of the White House Coronavirus Task Force. I am honored to receive the 2020 Bernard J. Tyson Lifetime Achievement Award. Mr. Tyson's decades-long commitment to improving access to affordable, high-quality health care for all Americans was truly inspiring. I am humbled to receive an award commemorating such a remarkable individual and to be included in the company of distinguished prior awardees, including Mr. Tyson and the legendary civil rights icon, Congressman John Lewis. I want to express my gratitude to the National Minority Quality Forum and to my esteemed colleague, Dr. Gary Puckrein, for this great honor. Mr. Tyson was a true visionary and thought leader. His many accomplishments in the healthcare field are inspiring, including his groundbreaking achievements while serving as the first African-American chairman and CEO of Kaiser Permanente. Throughout his career, Mr. Tyson worked tirelessly to reduce health disparities and promote equal access across the healthcare spectrum. His commitment to the importance of data and scientific evidence for providing quality, accessible health care, while always of vital importance, is particularly relevant today as we work to address the current COVID-19 pandemic. This unprecedented public health crisis highlights the importance of the ideals exemplified by Mr. Tyson. It also emphasizes the crucial role of community-based nonprofits and organizations such as the National Minority Quality Forum. You are doing critical work, shining a bright light on health disparities and bringing evidence-based interventions to bear in improving health care for all. My experience as a physician scientist addressing HIV/AIDS from the very early days of the pandemic, before we had effective treatments, to today, when we have the tools to end the HIV pandemic, yet so many still do not have access to these life-saving treatments, reminds me of the imperative of addressing health disparities. It is our scientific, political, and moral obligation to focus on the issues contributing to health disparities so that we can make meaningful progress in improving the lives of all people, especially those living with HIV, COVID-19, heart disease, diabetes, and the many other significant chronic and often life-threatening diseases and conditions that disproportionately affect people of color. While our personal experiences during this crisis will differ, it is important to remember that we are all in this together. I am heartened, despite the obstacles we face, by the unprecedented collaborations among public, private, and philanthropic scientific and public health organizations in addressing COVID-19. These collaborations have allowed us to move from concept to enrollment in large-scale efficacy trials of promising COVID-19 vaccine and treatment candidates in record time. As we evaluate these potentially life-saving tools, we must ensure that they are effective and accessible to all members of our diverse communities. We are working hard to ensure that participation in clinical trials reflects the diversity of the U.S. population. Partnerships between NIH and biomedical and community-oriented organizations, as well as the support of our brothers and sisters in communities of color throughout America, are crucial to these efforts. While I am cautiously optimistic that we will have a safe and effective COVID-19 vaccine by early 2021, we will continue to face many challenges in the days ahead. I remain encouraged by the ingenuity and dedication being exhibited by people across the country and around the world, and I'm confident that together we can overcome this crisis. We also must remember that many of the underlying conditions associated with more severe COVID-19 disease, such as diabetes, chronic kidney disease, and hypertension, are disproportionately experienced by people of color. In honor of Mr. Tyson and those who share his commitment to the elimination of health disparities, I sincerely hope that we can capitalize on the remarkable engagement and camaraderie we are building now to better address these long-standing health issues. Together we have the power to address the disparities that contribute to disproportional burdens of disease in communities of color. I look forward to seeing firsthand the ongoing improvements in health care that the National Minority Quality Forum and others who are carrying on Mr. Tyson's legacy are making possible. I would again like to express my sincere appreciation for this extraordinary honor. I hope all of you stay safe, and I look forward to continuing to collaborate with you in improving the health of all of our diverse communities across the nation.